It's a memorial really out here to Brett. We had a plaque put on here for him.
In the backyard of their stylish Scripps Ranch home, Bill and Camille Currier have built a memorial to their son, Brett.
When we went to go get the fountain, we found this hand. And we said, that's something Brett would love.
Camille remembers Brett as a cheerful, playful boy.
And he was always making faces. He was a really, really happy child.
But as she points to a photo of him as a teenager, she pauses.
This is where I saw him change. You go from a really happy kid to someone who you could tell he was troubled. You know, you could tell, but we tried. On
Thanksgiving Day in 2004, Brett killed himself. He was 22 years old.
There were no clues, there were no notes, nothing.
Camille had lost her younger brother to suicide years before.
This is my father, this is Joseph, and my other brother, Anthony.
He was schizophrenic and had previously made a number of suicide attempts. Camille says Brett was a heavy drinker. Looking back, she believes he used alcohol and other drugs to self-medicate. Suicides have become a major public health issue in the United States. Each year nationwide, more people die from suicides than from car crashes. And the suicide numbers in San Diego County have been on the rise. In fact, both the number of suicides and the rate per capita have been steadily increasing since 2010. 441 San Diegans took their own life in 2013. That's a record. Stan Collins is on the San Diego County Suicide Prevention Council. He also works on a statewide suicide prevention campaign called Know the Signs. Collins says the Great Recession may have contributed to the recent increase in suicides.
But one thing I'm always trying to get people to understand is that not one thing causes suicide. You know, bullying doesn't cause suicide, PTSD does not cause suicide, and that suicide is really the result of the inability to deal with the stress caused by situations. And the more situations you pile on top and stack on top of each other, the more risk there is for suicidality.
Clinical depression and drug abuse are also major risk factors. The CDC estimates for every completed suicide, there are 25 attempts. Deputy County Medical Examiner Jonathan Lucas says that should be a call to action.
And the opportunity is for us as a county to really intervene and somehow identify those people and divert their behavior.
Okay, so thank you for coming to QPR this morning. My name is Bonnie Bear.
That's what a suicide prevention training called QPR is all about.
QPR stands for Question, Persuade, Refer. And it's not therapy. It's only a way to offer hope and to get them in for help.
On a recent morning, Bonnie Bear gives QPR training to a roomful of high school counselors. Bear tells the group that suicide is the third leading cause of death for teenagers.
19% of all high school students thought seriously about suicide.
Tackling the issue is difficult, but Bear says asking someone who appears distraught if they've thought about suicide is actually a good idea.
If they are in that state, they have a sense of relief because finally someone understands, someone will talk to them about it.
More than 7,000 San Diegans have taken QPR training over the last few years.
A lot of kids do have a period of depression.
The training teaches people to recognize some of the warning signs of suicide and to intervene. The idea is that almost any positive action may save a life.
They'll probably get help and never have those thoughts again.
Trainees are encouraged to question a person about how they're feeling, persuade them to seek help, and refer them to counseling or a crisis line.
But I'm going to be honest with you, when you say that you wish you weren't here anymore, that concerns me.
Megan Turner is an academic advisor at Lincoln High School. She says it's tough having a frank talk with a troubled student.
It's never an easy conversation, ever, but I would rather have it and have them be angry with me than not have it and then get a phone call from their parents saying, you know what, so-and-so committed suicide.
Here's his graduation picture.
Camille Currier says since her son Brett took his own life, her faith has helped her cope with the loss. And it also gives her something to look forward to.
I really do think I'll see Brett again someday, and my brother, and I will ask him, what were you thinking?
Kenny Goldberg, KPBS News.